a $4.6 million beach resort in the Philippines, a Maserati worth $135,000, a Bulgari necklace worth $865,000. All of it seized by federal agents in a single week. All of it, according to prosecutors, paid for with stolen Medicare money. And that's just what one defendant bought with his share. On June 23, 2026, the Justice Department announced charges against 455 people across 45 states, including 90 licensed doctors and medical professionals, in what officials called the largest healthcare fraud takedown in American history. The total damage, more than $6.5 billion in false claims, submitted to Medicare, Medicaid, and other government health programs, in a coordinated operation spanning just 2 weeks. This isn't a story about one clever criminal. It's a story about an entire system, exploited from the inside, by the exact people licensed to protect it. Every year since 2007, the Department of Justice has run a healthcare fraud unit built specifically to catch this kind of theft, organized into 9 dedicated strike forces working across the country. Before this year's takedown even began, that task force had already charged more than 6,000 defendants over nearly 2 decades. But nothing in the unit's history matched the scale of what investigators uncovered this year. The operation spanned 56 federal districts and involved 50 state Medicaid fraud control units working together, the highest number of state agencies ever coordinated in a single federal action. International law enforcement got involved too. Defendants were apprehended and returned to the United States from as far away as Kyrenia, and Cyprus, and Estonia, and the Philippines, proof that some of the people running these schemes had already fled the country, believing they'd gotten away with it. Here's how the largest single piece of the scheme worked, and it's worth understanding in detail, because it's almost absurdly simple once you see it laid out. The product at the center of it was something called an amniotic wound allograft, a legitimate, sometimes genuinely useful medical product, made from donated placental tissue, used to help difficult wounds heal, especially for elderly and diabetic patients. Medicare pays for these products because, used correctly, they can prevent amputations and save lives. According to the Justice Department's own healthcare fraud data analytics team, total Medicare billing for these allografts sat under $1 billion a year as recently as 2021. By 2025, that number had exploded to more than $14 billion a year, a nearly 15-fold increase in just 4 years, with no medical explanation for why suddenly this many patients needed this specific treatment. Investigators found the explanation wasn't medical. It was financial. 11 defendants, including a company executive and 8 medical professionals across 6 federal districts, are accused of acquiring these wound care products at their normal, legitimate cost, then relabeling and remarketing them at a markup of roughly 2,000% before billing Medicare for the inflated price. Over roughly 2.5 years, this single scheme alone generated more than $4 billion in fraudulent billing, and the defendants actually collected $2 billion of it before investigators caught up. Prosecutors say the kickback structure behind it was designed specifically to reward doctors for prescribing a product patients often didn't clinically need, turning routine, elderly patients into unwitting vehicles for one of the largest single fraud schemes in Medicare's history, in exchange for what the Justice Department bluntly described as the kind of lavish lifestyles you'd expect the money to buy. That brings us back to the Arizona case, the one behind the beach resort, the Maserati, the Bulgari necklace. According to Acting Attorney General Todd Blanche, a single corporate executive in Arizona allegedly stole roughly $1 billion in taxpayer funds through this same wound graft scheme, billing Medicare more than $1 million per patient, for treatment most of those patients almost certainly never needed at that scale. Investigators say part of the proceeds were used to purchase that $4.6 million beach resort in the Philippines, a level of personal enrichment federal officials specifically highlighted as emblematic of exactly what this entire takedown was built to stop. The fraud wasn't limited to wound care. Across the broader takedown, prosecutors also charged defendants connected to fraudulent durable medical equipment billing, unnecessary laboratory testing, and community mental health services that were billed to Medicaid despite never actually being provided. Services that, in some documented cases, involved what the Department of Justice described as significant patient harm, including death. tied to opioid-related fraud schemes bundled into the same nationwide operation. One of the most striking individual cases involved a Houston woman, added to the FBI's most wanted fraudster list, accused of orchestrating nearly $100 million in healthcare fraud on her own, a reminder that alongside the enormous corporate-scale schemes, this takedown also targeted individual operators who'd built entire fraudulent operations around exploiting the same vulnerable Medicare and Medicaid billing systems. When federal agents finished executing search warrants and asset seizures connected to the takedown, they recovered more than $182 million in cash, vehicles, jewelry, and property. The Justice Department also finalized civil monetary penalty settlements totaling more than $73 million across 48 separate cases, a parallel enforcement track for allegations that didn't rise to criminal charges but still represented real financial harm to taxpayer-funded programs. FBI Director Kash Patel called the results historic, noting that his agency worked alongside Justice Department partners to charge more than 450 people, including nearly 100 medical professionals, calling every single arrest a continued message to criminal actors that stealing from American taxpayers would not go unanswered. Here's the part of this story that deserves real attention, separate from the staggering dollar figures. 90 of the 455 people charged were licensed doctors and medical professionals, people who had taken an oath to protect patients, who held the exact credentials that make a fraudulent Medicare claim look legitimate on paper. This wasn't a scheme run entirely by outside criminals hacking into a system from the margins. A significant portion of it was run from the inside, by professionals whose signatures and medical licenses were the very thing that made the fraud possible in the first place. That's precisely why this kind of fraud is so difficult to catch through routine oversight. A billing claim signed by a licensed physician for a real, FDA-approved medical product, submitted through the normal channels doctors use every single day, doesn't look like fraud on the surface. It looks exactly like healthcare. The fraud lived entirely in the gap between what was medically necessary and what was billed, a gap wide enough, across thousands of patients and multiple years, to add up to over $6 billion before any one official caught the pattern. This case is part of a much broader pattern federal officials have been increasingly vocal about. Medicare fraud, errors, and abuse collectively cost American taxpayers an estimated $60 billion every single year, separate entirely from this specific takedown, according to the FTC's own consumer protection data. This year's action represents the most aggressive single response to that ongoing pattern in the department's history, but officials were explicit that they view it as a beginning, not a conclusion. If there's a broader lesson in a case built almost entirely around licensed professionals and corporate executives rather than street-level scammers, it's this. Healthcare fraud at this scale rarely requires deceiving anyone directly. Patients in many of these schemes weren't lied to in an obvious way. They received a real product from a real doctor that may have even been genuinely marketed to them as beneficial. The fraud existed almost entirely in the billing, in the markup, in the gap between actual medical necessity and what got charged to a government program. Most patients never see the invoice for it all. For ordinary patients, the most direct protection is surprisingly simple. Request and actually read your Medicare summary notice or explanation of benefits after any medical visit, and question any billed service, product, or supply you don't specifically remember receiving or agreeing to. Fraud at this scale depends heavily on patients never checking the paperwork at all, because when no one reviews the bill, an inflated or entirely fabricated charge has no one left to catch it before it's paid. As of this recording, prosecutions connected to the 2026 takedown are still working their way through courts in 45 states. Acting Attorney General Blanche was direct about what comes next, telling reporters this is only the beginning, and that fraudsters can no longer treat American taxpayers as an unprotected source of profit. $6.5 billion. 455 people, 90 of them doctors. One beach resort in the Philippines, bought with money meant for elderly patients' wound care. The most unsettling part of this story was never the size of the number. It's how ordinary the fraud looked on paper, every single day, for years, before anyone official noticed at all.